Blowback on the Trump administration's controversial claims about autism and Tylenol mounting worldwide this week. Health officials from the UK to Australia are rejecting the president's warnings to pregnant women to avoid the painkiller. This comes as his own administration appears to be walking back the warnings. Meantime, confusion about what's safe for mom and baby flooding doctors' offices and family rooms across America. And that is not the only concern. Recent CDC recommendations on childhood vaccines, or lack thereof, are also causing chaos, from hepatitis to COVID, measles, mumps, rubella, and chickenpox. Joining us now live to discuss is pulmonologist and NBC News medical analyst, Dr. Vin Gupta. Doctor, thanks for being with us tonight.
Good evening, Joyce. Thanks for having me.
Well, first of all, I want to start with just how you would describe this moment that we are in when it comes to public health in America.
Well, public health in America has always had its challenges, Joyce, and yet we're distracted on issues that should not be amongst our top priorities, both from a time standpoint and a resource standpoint. We have enough challenges as a country when it comes to our healthcare system. I'm sitting here in an ICU not far from you in downtown Seattle. I see it every single day, just like my peers do, our public health professionals do. There's a lot of stuff we should be focused on from a bipartisan standpoint to get right. Detailing and debating Tylenol and pregnancy and the childhood vaccine schedule are not urgent issues that we should be spending any time discussing.
What does the president's guidance on Tylenol mean for pregnant women who, as you know, already have so many concerns and fears during pregnancy?
Well, I think at minimum, it's caused a lot of confusion amongst the American public. And there's a lot of people, even obstetricians and gynecologists, who say, how should I navigate these waters here? Will I be in trouble if I recommend Tylenol to my patient who rightly might need to take it? And there's no evidence supporting what the president is putting out there. There's poor quality research from a few years ago, decades ago, up until a few years ago, that suggested a very small link between taking Tylenol during pregnancy and potentially a link to autism development in baby after birth. That has been serially proven wrong by very high quality research in just the last few years. And yet this administration, Joyce, we've talked about this, does what it is very good at. It cherry picks data. It sends the wrong message to the public. It causes confusion, whether it's fluoride in water, whether it's the mRNA vaccines, whether it's the COVID vaccines, hepatitis B, measles, mumps, rubella, and now we're adding to the list here Tylenol and pregnancy. It's never ending. But what I'll say for women out there, have a conversation with your medical provider. Assuredly, you have questions, no doubt. There's nothing wrong with that. More than anything else, just talk to your medical provider. And if you don't have a medical provider, and you're an adult watching this, is establish care with a primary care physician. 40% of adults across the country, Joyce, don't even have a primary care doctor. In some cases, they have insurance. They just choose not to establish that care. Really important to have a medical provider you trust in your life.
To get really good, sound medical advice. Let's talk about standard childhood vaccinations, which the president is also questioning, saying that it's too much to be injecting into infants. What do parents need to know about that?
Well, last week was its own sort of kerfuffle when it came to the measles, mumps, rubella, varicella combination shot choice. And this is a shot that was remains recommended for kids 4 years of age and older. Measles, mumps, rubella is a varicella. You need 2 shots to cover against all 4 of those infections. And what happened is confusion that was unnecessary. This combination shot was not recommended as a first-line option for young infants. When you're first supposed to get your first dose between 12 and 15 months of age, pediatricians recommend splitting the doses, MMR and varicella separately, because there's a small risk of febrile seizures, a condition that is self-limited. Frankly, the infections themselves cause that at a greater rate than the vaccine itself, the combination vaccine. But anyhow, we're having all these conversations. It's very confusing. And there was no need for it because the recommendations as they existed prior to last week were very much in alignment with what the Kennedy HHS wanted to put out there. So there was really no need for this debate. All it's done is cause confusion. So again, same recommendation here. If you're a parent out there and you're confused, please talk to your pediatrician, your child's pediatrician. And if you want information right now, go to healthychildren.org. It's produced by the American Academy of Pediatrics. Clear, navigable information about childhood vaccines.
Healthychildren.org. Dr. Vin Gupta, thank you so much for taking the time. I know you're in the emergency room and ICU right now and taking a short break, but we appreciate your insights so much. Thanks.
Thank you.